right, many thanks, Ibrahim Hamidu, for that background report. And we have been joined indeed by our guests, some of our guests, to discuss the male infertility issue. And let me begin by introducing here in the studio Dr. Lemesh Nabasu, who is consultant urologist and head of surgery department at NISA Premier Hospital here in Abuja. A pleasure to welcome you to Good Morning Nigeria.
Thank you very much.
All right, let's also introduce Dr. Isiaka Lawal, Chief Consultant Urologist at the National Hospital, Abuja. We thank you for coming.
Yeah, good morning, and thank you for having me.
All right, Yuri.
All right, so let's begin the conversation. I'd like to begin with Dr. Lawal. When you hear male infertility, no, you don't even hear it. I think I should begin from that. Like in this climate, it's very rare to hear that a man is infertile. You mostly hear about women infertility. So please tell us, what exactly is male infertility?
All right, thank you. Well, you are correct. We only hear about male infertility, but it's very common. Now, basically, infertility refers to the inability of a married couple to achieve pregnancy despite regular, unprotected sexual intercourse for a period of at least 1 year, having been cohabiting together. It's a very common problem in this environment. About 15% of couples actually have a problem of infertility. Now, the infertility could be of male origin, could be of female origin. But surprisingly, the etiology is almost the same. In fact, studies have shown that infertility, the male cause over 40%, whereas the female is about 40% as well. And about 50%, about 15% can be due to factors from both male and female. When you have about 5% that of unknown etiology. So you can see male infertility is as common as female infertility. But because of our environment, that society influence, once a couple have a problem of infertility, the woman always bear the blame. So it's a very common problem in this environment. And because of the society, a lot of time, one, the male don't speak out about it. Two, the pressure is so much on the wife, and it's the wife that actually seek attention first. When the wife now go to see the gynecologist, during the post, they now realize that the problem is not with the woman. You need to invite your husband. So a lot of the time, it is in the process of evaluating the wife. They now found that the problem is not with the wife. They now invite the husband.
You know, I'm a woman, so I would like you to break it down. Maybe Victor may understand some of the things that you have said. Because for a woman, when you say infertility, maybe she's not producing eggs, maybe her womb is not conducive. These are, you know, the issues surrounding women, infertility in women. But for a man, is it that there's no erection, or is it that there's no sperm release? I mean, how are you able to say that, you know, this person is infertile as a man?
For a man to impregnate a woman, that man must be able to produce sperm, that's spermatozoa, which must be of an adequate volume, and there need to meet some parameters, which are the motility, the morphology, that is the normal forms and the abnormal forms. Even if the man is producing adequate sperm, but the motility is low, he may not be able to move fast to be able to fertilize the egg. So that is the primary problem. Now, any condition that is going to affect the production of sperm, vis-a-vis the quality of the sperm, the quantity of the sperm, the morphology, is going to lead to male infertility. And there are a variety of causes, but to make it simple, I will look at it this way. Sperm is produced by the testis. But for that testis to produce the sperm, it depends on hormone from higher centers from the brain, which regulate the production from the testis. Now, when the sperm is produced, it has to be transported through the duct, the ejaculatory duct, and the vas deferens before it can be released. So when you have an anomaly, either from the higher center like the brain, or from the testis itself, or during the passage, any of these three, or combination, can lead to male infertility.
All right, thank you very much, Dr. Lawal. Now let me get to Dr. Nabasu. Yeah. Beyond the health issues surrounding male infertility, What's the place of lifestyle choices, alcoholism, and the likes in all of this?
Okay, thank you very much. If you look at the causes of male infertility, there is a place for lifestyle choices as well. There are some lifestyle choices that people go into that may affect fertility. You have mentioned one. Alcoholism is one. If you look at the list of causes, part of the whole thing is alcoholism. As long as the individual is taking this for a long time with and also the dose of whatever it takes over a long time. Alcoholism is just one. Cigarette smoking and also other substance abuses like cocaine, marijuana. So there are so many things that one can indulge in that can affect the function, just like he mentions. Just like my colleague mentioned, the function of the sperms, everything, the function of the testicles, anything that affects the function of the testicle will affect the fertility of that individual. So these things can affect that. Diet as well, malnutrition, that is why when we are talking about the treatment, we bring in supplements on some occasions, because if the cause is dietary, nutritional supplementation can also help in reviving that testicle to some extent, not all the time, depending on the cause. Radiation as well. So lifestyle radiation can affect the testicle, either inadvertently or advertently. People whose occupation entail or involve exposing themselves into radiation, like even hospital workers. That's why there are a lot of regulations to make sure that those people are protected. So there are a lot of gadgets in the hospital that can predispose one to excessive exposure to radiation, apart from the natural one. So as well
phones?
As
you talked about radiation from phones.
Not the ones from phone have not been found to be adequate to cause harm to people like that. I'm talking about gadgets like X-rays. That's why when you go to health institutions, when they're about to expose a patient to X-rays, they protect themselves because they are there always. The patient is just there to be exposed once. The workers are there all day,
on a daily basis,
exposed. So they need to protect themselves, and there's a way to know the radiation dose one individual has received in a day. So there are some machines that can pick that. So people are protected. But if one is just not taking those measures to protect themselves, that can affect the function of the testicle.
You talked about diet.
Yes.
Is it possible for a male child that is born to grow to adulthood and have poor sperm quality naturally?
Yes. There must be a problem, though. A child can grow to adulthood and develop problems. The problem may have been from
birth.
From birth. Yes.
So what are the factors from birth that could lead to poor sperm quality and eventual infertility?
Some children, even before birth, while they're developing in the womb, there's a condition we call torsion and vanishing testes. The testicles can reduce in size over time. They shrink due to progressive twist. That twisting of the testicle against its blood supply can happen even before birth. After birth, it can happen. So when that happens, the parents may not even know. A child complaining of testicular pain may not know the implication, will not know the implication of that. The parents, most times, especially in this part of the world, do not know the implication of that. So once there is a relief, they don't seek medical attention. So if that keeps happening, it continues to injure the testicular cells, the ones that are involved in producing sperms. So with time, the population of those cells continue to decline, and that can lead to infertility.
Does the size...
So by the time they get to adulthood, they will not... In fact, you have to ask them, you have to go back And sometimes the patients don't know themselves. But if you have the privilege of meeting the parents, they may tell you, oh, he used to complain of this, he used to complain of this. Sometimes, if it happens at a time that the child is aware already, they might tell you, okay, I used to have this. I didn't really know why it happened. That might actually be the cause. So some of the causes you can get from history, not necessarily examination or laboratory investigations.
So
that can happen.
Okay.
And sometimes some of them, the testicles may not descend. So once a testicle fails to descend, it develops in the tummy, the testicle, while the child is developing in the womb. So it develops in the abdomen. And shortly before birth, it descends, it drops into the scrotum. So if that process can get arrested along the way. Once that fails to happen, it can be in the abdomen, it can be in the groin, it can be somewhere close to the scrotum, but not in the scrotum. That can affect the function of the testicle because the temperature inside is not the same thing as the temperature in the body is not the same thing as the temperature in the scrotum. God has made it such that there's a difference, and that is the comfortable place for the testicle to be. If it doesn't drop into the scrotum, the function gets affected, and then sperm production is hampered.
This dropping, is there a way to detect early, as in a mother who has a male child, to be sure that everything is in order? That's one. Then does the size of the male reproductive organ affect fertility?
No, not the size. You're talking of the penis, right?
Yes.
No, the fertility. Everything about fertility in a man, has to do with the testicle itself. Like he mentioned, my colleague mentioned, anything that affects the testicular function will affect fertility, not the penis. The size of the penis, yes, to some extent, if it's so bad that it can affect intercourse, yes, I can say yes. But otherwise, the problem almost always comes from the testicle. There are some other causes, yes, that can arise from there, the size, if it's that bad. So going back to your question,
the dropping of the
yes.
You said something needs to drop at the
testicle,
the
yes.
testicles, right?
Yes.
So
it needs to drop into the scrotum.
So how does a mother check that it has dropped? And at what age is it supposed to drop?
It's a routine at birth, shortly before birth. It drops shortly before birth. At birth, the pediatricians will always check, or the birth attendants, the nurses, the midwives, the neonatologists, what we call, that's a subspecialty in pediatrics. There's doctors who deal with children. So they always check all parts of the body, including the scrotum, the head, the trunk, the genitals, the limbs. They check everywhere to be sure everything is normal. So if they find that the testicles, just by simple palpation, if they find that the testicles are not in the scrotum, they raise alarm. So most times they refer to us or the pediatric surgeons. So they may land in our clinic or the pediatric surgical clinic. That is the way. So parents who are not aware of this may not even know. So if they are not aware that testicles develop somewhere and they drop in the scrotum, they may not know. If it doesn't drop, there's a way you look at the scrotum itself. It doesn't develop well. It looks small. That's the sac, the scrotal sac. It looks smaller than usual, like it's supposed to be. But if the testicles are in the sac, you see it well developed and all that. So that's something that parents should understand, and they check all the time. So to answer your question, parents can check just by palpation once the baby is born. In case it is missed in the hospital, you raise alarm as a parent.
All right. Thank you very much, Dr. Nabasu. Let me get back to Dr. Lawal. Now, stress is often underrated. To what extent can stress interfere with male fertility, and how can this be managed?
Okay. Stress can intervene in a significant way. Like I mentioned earlier, the causes of infertility can be broken down into three. Either factors from the higher centers that affect the production of hormones that regulate production of the sperm from the testes, or from testing itself, some of which I mentioned, or from the delivery. So when you have stress, what usually happens is that it tends to affect the higher centers. It can alter the normal regulation of the hormones. Now, what hormones are we talking about? We're talking about hormones like FSH, follicle stimulating hormone, LH, luteinizing hormone. These are produced from part of the brain that we call the anterior pituitary. And the regulation is usually depending on so many factors. So when the person is subject to stress continuously, it can alter this normal circadian rhythm, and that can affect the regulation of the sperm production.
Now, what then is andropause?
Okay, well, actually that word andropause is a misnomer. Because when you say andropause, you are looking at it in the context of menopause in a woman. But what you have in a man is not really andropause. The appropriate term is what we call Adam. Adam, A-D-A-M. It is androgen deficiency of the aging male. Now, what happens is that it has been established by studies that by the time a man is 40 years of age, after that 40 years of age, there's a gradual reduction in the level of testosterone by about 1% every year. Now, testosterone is a male hormone. It is what makes the voice of the man to be very thick. When a man talks, you know that that's a man talking. It's what for the muscle bulk. It what gives man the libido. Libido is the urge for sex. It also helps in the erection. You understand? So when so by the time a man is 40, this reduces gradually. And it can take a long time because it's just about 1% every year. The impact is not felt. By the time a man is 60 years, maybe just like 20% gone. So it's not significant. So it's gradual, unlike in the menopause in the female, which are about 40 to 45, once there is no longer ovulation. And so in the woman, it's so sudden, you have all those features of menopause. But in the man, because this thing is gradual, the impact is not felt much. But even when it becomes manifest, what are the things you see? The things you see is, one, there's decreased libido. That's why you see a man of 70 years. The libido will not be as strong as somebody that is 30 years or 25. The erection may not be the same. If you look at the muscle bulk, that's lean body mass now, if a man of 70 years, it will not be that of 30 or 40 years. The same thing with the voice. So all these features are due to the effect of the gradual reduction in the level of testosterone. But because it's not sudden like you see in the female, it takes a long time. That is why you can see a 60-year-old woman, 70-year-old, some of them may still be very sexually active. All right, you see a woman of 50, you understand? The reproduction is already almost down. You're
talking about libido.
Yes.
You know, does libido affect fertility? I mean, it's not about the frequency of sexual intercourse, right? It's about being able to impregnate a woman. You know,
okay.
So now you talked about reduced libido at old age. So, how does libido affect fertility?
Libido is the urge for sex. For you to impregnate a woman, even if you just one time you have sex, you can impregnate a woman.
But you hear men.
Right. Now, when a woman has sex, when a man has sex, it's not just to impregnate a woman. There's also the social aspect for satisfaction. So the libido is the urge for sex. It's different from fertility. For fertility, we are talking about being able to produce sperm of good quality and being able to fertilize the egg of the woman. So even if a man has sex once in a week, the man may not be happy because he's not having enough sex. But that one in a week can impregnate the woman.
So at 70?
Yes, at 70 it's possible. At 70 it's possible because, like I said earlier, what you have in a man is a gradual reduction in that testosterone level. It's not a sudden and abrupt total cutoff. So a man of 70 may still be able to produce, as long as the testes are there, you still have a lot of reservoir. But it will not be as active as that of a 40 or 50-year-old.
Are there factors that determine how this reduction happens? So is it at the same level for every man?
No, what I just told you is the pattern, general pattern for everybody. However, there are some conditions that are made out to come much earlier. For example, there are some disease conditions now. You mentioned some of them. If somebody is exposed to radiation, if somebody has malignancy, for example, is under chemotherapy, that can make it faster, happen faster than usual. If somebody's testis, yes, I mean somebody has had torsion in the past, one testis is gone, the other testis is already compromised. That kind of person, the testosterone level is going to be dropping gradually. If somebody is a person that abuses drugs, opioids, that can depress the testicular function. So it's a gradual thing. But all things being equal, what you see is about 1% per year from the age of 40 years. Now, there was a question you asked earlier. Let me just chip that in. You're asking, is it possible for a child to be born normally and becomes an adult with abnormal sperm? Yes. Apart from what you have said, there's a condition we call varicocele. That varicocele is very important, and we'll take time to explain it. The veins around the testes, when they become abnormally dilated, blood stays around the testes for longer than necessary. So the temperature around the testes becomes normal, becomes high, like that of body temperature. Now, like he said, the testes normally descend at birth into the scrotum. So the temperature of the testes because that cause that temperature to rise is going to affect sperm production. So when a child or an adolescent has varicocele, it's going to cause impairment in sperm production. So the best can produce sperm, but the quality vis-a-vis the motility and the morphology will be poor. Now, that problem, varicocele, has been there since birth, but does not manifest until adolescence, usually by 15 to 18 years. Now, unfortunately, that's when adolescents tend to be very shy. They don't want to share anything with their mom. So a lot of them may not even tell their parents that they have a problem until it becomes so bad. But it is one condition that if it is picked early, it is reversible. It is correctable by surgery. So once any adolescent or young adult has pain in the testes, he must see a doctor as soon as possible.
What if the pain is as a result of injury or maybe a fight?
That is any pain in the testis. The testis is a very vital organ in the body. After the heart, the next important organ in the body, as far as I'm concerned, is testis. So once an adolescent, because that is what the time whether you're going to be able to procreate or not. Also, once you have pain there, yes, the pain could be from trauma. It could be from the torsion. That torsion that he mentions, and that's very important because once torsion means that the testis is twisting on itself. When it twists on itself, the blood supply is compromised. And if that patient does not get to the hospital and intervene within 6 hours, that man or that young adult can lose that testis. So any kind of pain in the testis must be treated as an emergency, whether it is from torsion, whether it's from trauma, whether it's from varicocele. It's very, very important.
Now, you talked about abuse of drugs,
yes,
opioids, for instance.
Yes.
But what about regular medications? Can that also lead to gradual decline of libido?
I don't know, not libido now, but sperm production.
Okay.
There are some drugs that can put the testis at risk. That's why for any of these major drugs, before you take it, you see your doctor. I mentioned one earlier. A patient is on the chemotherapy. Chemotherapy, those are drugs that are used to treat cancer. So once a patient is diagnosed with cancer and that patient still intends to have more children, or is not married, there are some patients that are not fortunate enough, they have cancer even when they are not married, or they are married, they don't have issues. So if you now choose between the two, if you treat the patient with chemotherapy, it can damage the testis and the patient will not be able to fertilize. So what you do in such a case is that you bring the patient to cancel the patient and the wife. You can do sperm banking. They can take some of the sperm and a lot of centers now in Nigeria, fertility centers, have facilities to be able to store, to preserve sperm. So you can do that. So the patient goes for the treatment. By the time the patient completes the treatment, the testis may not be viable again. But because he already has sperm preserved, they can now use that for fertility. Okay. So that's one case.
Many thanks. Just to let our viewers know that they can send in their questions and comments as regards this topic. The number is displayed on the screen. I'd like to get to you, Dr. Lemesh. This is an eye-opener, I must say, because just recently I was on the internet. There was a particular pastor's wife that was talking to women about infertility, and her comment was, if your husband has a problem, try to conceal it. Don't talk about it. Deal with it, manage it, you know, because in our climate, once a woman is not getting pregnant, it's saying that she's the problem and never the man. And we've seen families going through such conditions. The men never seek medical help. It's always the women running around to get help. Speak to us about some of the misconceptions of male infertility, because you hear people tell you that, oh, my father is 90, he just got a wife and the wife is pregnant, right? So how can I be 35 or 40 and you're telling me I cannot, impregnate you? So, I mean, really, this is
more African.
Yes, this is a
Outside the country, it doesn't happen like that.
So what are the major misconceptions, especially when patients come to you and you find them, they have problems? What are the things that they think in their head? What are the things that we need to correct as Nigerians or Africans, like you said?
Yeah, thank you. You are right. When I grew up having that wrong notion that once there is infertility in a couple, like you defined, it's always from the man. Sorry, from the woman. Yes. So I grew up having that notion until I became a doctor and a urologist, for that matter. That's when I got to know the data that he mentioned. 40% from a man, 40% from the woman. And then the two of them, 15%. And some causes you may not really be able to find out, yes. So it's a very wrong, it's a misconception actually, and that is the major one. So many men come, when they come, some of them don't come with their wives. When they come for fertility evaluation, they leave their wives at home, and they don't want you to even mention anything close to the wife. They don't want their spouses to know. And that is part of the misconception. So he doesn't believe that the problem can be from him. So he wants to know, even if he gets to know, he wants to keep it to himself. And that is not good. So if he doesn't open up, if he doesn't want you to help him, of course, there's no way you can help such a person. How will you do it without letting the wife know? Because if eventually they require fertility treatment, that's in the form of assisted reproductive techniques, how will you do it? Because it's the wife that will carry the baby. So it's a big misconception, and that is the main one. Men not believing that the problem is from them. So they always send their wives. Like you said, when the women come, it is in the process of evaluating the women that once the gynecologist check, there's no problem with the cervix, no problem with the uterus, the hormones are okay, the higher centers are okay, the tubes are okay. They now send the men, they ask for the man to come. Once they check the semen parameters, they check, so they see that the parameters are not optimal in terms of the count, the motility, the morphology. So it is at that point you see most of the men, like in my own practice, that's when you see most of the men. Is when the women come to the clinic, you now see you hardly see a man coming to the clinic say he wants to check his fertility. Once in a while I see them, but most of the time it's the other scenario. Thankfully, the awareness is increasing a little bit. We're beginning to see young men coming to say, I'm planning to get married, I want to check. I work in a fertility center rather. So they come, say, I want to get married. I will get married very, very soon. I want to know my fertility status. And that's very easy to check. What you need to do is just to check the semen parameters, because everything revolves around it.
Is there a possibility that frequency in sexual intercourse could lead to infertility in future? Did you get my question?
Yes.
Say if the frequency is too high or maybe too low, right? Once you become an adult man, does it affect your fertility later in life? And then secondly, does your activity, I don't know how the men describe it.
I think you're trying to ask, she's trying to ask whether you could exhaust the sperm.
Yes. Can you finish? No. Then secondly, Victor, then secondly, does your capacity to, Victor, give me the right word.
No, find it.
When you're active with a woman,
yes.
If you're very active, can you be very active during intercourse and be infertile?
Yeah. You can be very active and be infertile, because he told us earlier that the two are completely different.
libido.
Yes, male
fertility,
sexual function is completely different from fertility. You can
Because
be
you
very
hear men
active.
say, try me, you know that I'm,
Exactly.
So,
They
but
say-
it's not, is it about the trial or it's about whether you can deliver?
They say that to us also. They say that to us when they come to the clinic. So they believe that once you are active, yes, you are capable of impregnating a woman, but that's not true. You can be very active as whatever you can use to describe it, but you may be completely infertile, nothing. Because if you look at the semen is just the water. The hormones may be okay, everything may be okay physiologically to make the man very active sexually. But looking at the testicular function, that fluid that you see during ejaculation is a contribution from the different parts of the genital tract, from the seminal vesicles, what we call seminal vesicles, the prostate, and some other organs, as well as the testicles. So the contribution from the testis is what is very, very important. That's the sperms themselves. Earlier you showed, there was a video displayed here. Those cells you see moving inside, when you put them under the microscope, those are the sperms that actually move actively to go and fertilize the egg. So if those sperms are not there, they may not be there because of the several factors that have been mentioned. Higher centers, the testicles themselves, or even obstruction. It can be obstruction. The testicles may be producing, but the cells may not get to where they're supposed to get to. So, yes, the answer is that they can be very active and infertile at the same time. So if those cells are not there, they cannot impregnate a woman.
And sperms cannot finish.
All right.
Sperms cannot. Well, are you talking about the semen or sperms?
I think she's talking
Semen,
about if
sperms can finish. Sperms can finish if there is a
so
medical condition that will affect the production, as mentioned. But the semen will always be there. The person will always be able to
produce.
Yes, produce semen. Or the person will be active sexually. But the sperm, something can happen along the way and affect the sperms that you won't see inside the semen.
If you're docile,
Right.
does it affect the sperm? Say a man who is inactive, does it affect how active your sperms are?
A man who is not active sexually?
Yes.
No. It's if you are inactive sexually, the sperms can still be there.
And viable.
And viable.
All right.
The sperms can still be
I
there.
have questions of my own. I'll come to demography shortly,
Yes.
but I understand our correspondent in Port Harcourt, Robinson Derataide, is waiting for us live to give us a situation report from Rivers State. Good morning, Robinson.
Good morning. Yes, we are already at the airport waiting to receive Governor Siminala Ifobara, who ought to have resumed yesterday, but yesterday he couldn't make it. As you know from the reports we gave yesterday, a lot of people trooped out to receive him. The crowd was much. And today also we are not expecting legs, because even at the airport a lot of people are already here waiting to receive him. We have over 10 commissioners and former heads that are already here waiting for him. Today is going to be a wonderful day in Rivers State, because the people are waiting to receive him, and also to ensure that civil governance begins earnestly in Rivers State. As you are aware, yesterday the State Assembly members also sat, and they had their first plenary yesterday, and this shows that peace has returned, and Rivers State, as usual, will join its other mainstream states in Nigeria for good governance. I have with me a former Deputy Speaker of the Rivers State House of Assembly, and also a former commissioner who I'll be speaking with. His name is Marshal Unwo. Sir, tell us, how do you see the atmosphere this morning to receive Governor Siminala Ifobara?
We wouldn't have expected anything less, because indeed there was a vacuum in the state. The people of Rivers State, indigenous and non-indigenous, had yearned for the presence of the governor. Recall that prior to his absence, we had made so many impactful projects, developments within the state. The civil service was not left out. The educational sector was not left out. Infrastructural development were monumental, but his absence had created a dearth. And that vacuum we are looking forward to ensuring that and seeing that the vacuum is occupied. The people of Rivers State, and in fact commercial activity had really dwindled in his absence. The psychological trauma that people experienced, we believe that that should be assuaged, and I believe that's the reason for which there was a tremendous and monumental turnout, right from Government House down to Azigboro Park was all filled with human beings, and they looked forward to seeing the governor, a governor that is loved by his people, a governor that has shown leadership that is representative. He is indeed a servant leader. And we must use the opportunity to also commend all parties for embracing peace. We hope that this peace is consolidated. We commend His Excellency, the President of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu. Well, we commend him because he has shown some fatherly disposition, and we want to say to him that you have a reliable ally in the governor of Rivers State, Sir Similari Fubara, because he has shown that even in the midst of provocation, he ensues peace and he preaches peace.
Thank you, sir. That is the situation this morning. A lot of journalists are also here. They are all waiting to receive the governor and also to give him the necessary broadcast that is needed. A lot of people are also outside. You could hear the sound of drum set. They are outside. They are not allowed to come in because we are at the VIP wing of the airport.
Robinson Daratayde, thank you very much for the update. I guess you will be back with us if Governor Siminalayi Fubara gets into town before we leave here, or at any time, by the way, for that matter. Thank you very much. But back here in the studio, I was talking earlier about demographic in terms of age. What do you find in your experience and practice? Are you seeing younger men coming in, for fertility tests? And what could be the cause of all of this?
Yes, the answer is yes. I'm seeing younger men coming for fertility evaluation, and in actual fact, younger men coming with fertility problems. And the causes are many. They are not different from
Any
what
age
I've
range?
mentioned. From the age of, in their 20s, men as early as in their 20s. Yes, in their 20s. We've seen those causes that we talked about that can start from childhood eventually affect them by the time they get to adulthood. So, because most men get married at that age, 20s, in their 20s, 30s. So that's when you get to know that there is a problem. So we are beginning to see them coming. Like I have earlier mentioned, some of them come, through the fertility clinic, the gynae clinics, when the problem is when their women report to the clinic, because health-seeking behavior of women generally is more than that of men. But like I said earlier, some men are coming on their own. They would have checked somewhere, and they would tell them, "Oh, you have low sperm count, you have or no sperm count at all."
That's all.
Then they now come. I want to really confirm. They may have checked 3-4 times elsewhere. So when you check, most of the time you will see the same thing. Either low sperm count or absence, total absence, which is what we call azoospermia. The causes are many. Like you earlier mentioned, some causes are from the
Doctor, it's
higher
important to
centers.
mention.
Yes.
It's important to mention that those with no sperm
Yes.
count at all
Yes.
produce semen after intercourse,
They
right?
produce semen. They produce semen, but no sperms at all. That's what we call azoospermia. Those who have low sperm count, we call it oligospermia. So some causes from the higher centers, like the hormonal problems that you mentioned, some causes affect the testicles directly, either from the trauma, from infections. Some infections may have occurred long time before presentation. Some viral infections, what we call mumps. There's a particular infection that affects the parotid glands. There's a glands, a salivary glands. It also goes during that process. It can go into the bloodstream and affect the testicles as well, and lead to...
But mumps is a viral infection without cure, right?
Yeah, it resolves...
Without treatment?
Yes, it resolves spontaneously. It resolves with... most viral infections are self-limiting. So it limits itself after some time, but the damage would have been done to the testicles. So it's in adulthood when they are trying to conceive with their wives, they now discover there's a delay.
So how do
1
you
year,
detect early
2 years
that
down
mumps has resulted?
It's from history. It's difficult to... Unfortunately, there's nothing much we can do about that. If it happens, if one is lucky, there's no effect on the testicles that much. You can spare some aspects of the testicle. Thankfully, the testicle, if it's failing, it doesn't... Most of the time, it doesn't fail globally. You still find some portion, some foci of the testicle that are functioning, that you can explore and still get sperms from there. So it's difficult to know early until they get to a time that they will start start ejaculating. That's when you can investigate.
All right.
And then know.
Thank you, Dr. Lemech.
Yeah.
Dr. Lawa, let's talk treatment now. Are men helpless in many of these cases, or they can still be helped?
No, men are not helpless. They can still be helped in a number of cases. And that is why, when I was telling you about the causes, I listed it into 3 different groups. So when you see the patient and you establish that this patient has male infertility, like any clinical condition, the first thing you do, you want to take a detailed history. And the issue is to focus what is the likely cause. Is that cause, is it something that is reversible? Reversible by surgery, that is operation. I give an example earlier of varicose. Varicose is one case that is very common in young men with infertility. But if it's picked early, it's reversible. Once you do the surgery, the sperm parameters, the count, the motility, morphology improves. So that's 1. 2, we want to find out where is the pathology. I've had a patient that had a brain tumor, pituitary macroadenoma. That's a tumor that produced certain hormone that indirectly was now suppressing spermatogenesis. So that patient was referred to a neurosurgeon, and the tumor was removed. After about 6 months, when we checked the sperm parameter, it was normal. Yes, we've had patients that have blockage. Now, that's in this particular patient now, the patient is producing sperm, but the passage from the sperm, from the testis now, it has to pass through the epidermis, get to the vas where it is stored, to the ejaculatory duct before it is released. If you have blockage along that part, that patient will appear infertile. But once we are able to treat that surgically by doing some operation, like vasostomy, you can open other passage. So men are not helpless. Now, that is on one aspect. Even in very bad cases, now where you have exospermia in quotes, the patient is producing semen. You look under the microscope, there are no sperm cells. But you can't see any viable sperm cells. With the improvement in reproductive technology now, it's much easier to do what we call assisted reproduction. In which case, you can take the patient to the theater, you just take some tissues from the testis. Even if you just one sperm cell you see, or 2, you can take egg from the wife and fertilize. Unlike what was not available in those days. The only problem is the cost, but even as that is getting better.
What's the range?
As per the cost?
Yes.
It's quite expensive. But the good news that for a long time, it's expensive because most of them are domiciled in private hospitals, most of the fertility centers. But right now, we have some government hospitals. In National Hospital, we have a very well-established fertility center, and the cost is much cheaper than what you get in a private hospital. But it is expensive because of the drugs. Most of those drugs are imported, and because of the exchange rate now. So going forward, if the government can look at possibility of giving waiver on some of these drugs, bring down the cost. Yes, because for some patients, after you have excluded all the courses, you have done all the tests, some of them can even spend up to 2 or 3 million. What takes the bulk of the money is the investigation as well as the medication itself. The technical fee is not really too much.
Doctor, I'm thinking, he spoke about temperature earlier.
Yes.
As being a factor.
Yes, it is.
Where is global warming affecting how our bodies behave? Because he's talking about more men coming down with this condition of infertility. I don't know. It's just a random question in my head.
Yes,
is climate change affecting, such that we're having hotter temperatures and all? Is it affecting that axis also?
Well, the nature is so wonderful. The testis ideally should be fully descended at birth. And when the testis is in the scrotum, the temperature is much lower than the body temperature. The global warming we're talking about affects the environment as well as the body temperature. So once the testes are there in that scrotum, usually is preserved. However, one of the conditions that can cause that high temperature is varicose, I mentioned earlier. Then young men that also wear very tight pants. That can also affect it. That's why we always encourage them that it's better, when they wear boxers, the testes are free, it's better.
Regularly or sparingly?
Oh no, regularly. When you wear tight pants most of the time, it's not testis friendly.
So from childhood, is it advisable for parents to ensure their male children?
No, from childhood, it's advisable that before that child gets married, the mother should always cultivate the habit, or the father should be checking the testis or the scrotum regularly. You mentioned one condition earlier, undescended testis. You'll be surprised that some of them, the parents will not even know until that child is already an adult. So you don't check. So the parents need to cultivate the habit of checking their male children from time to time. You don't just say because they are now in secondary school, then you leave them like that. We have a patient with bilateral varicocele, which is something that is surgically correctable. But we won't detect it. On the patient get married, they now have issue of infertility, which if the parents have been checking, by 15 years of age, this thing will have been picked and can be treated.
Is diabetes a causative factor of infertility?
Diabetes can be an indirect, but not really a direct cause. It's like what it will do, it's because of impaired immunity, it may, but it's not really a direct cause. The direct cause are the ones I mentioned earlier.
And at what age? You talked about tight panties and all of that. At what age should that become a practice, or is it from birth?
No, once is an adult, or from adolescence, we always encourage it.
Teenage?
Yes, we always encourage that, so that the place will be well aerated, tight pants, and should pay more attention to the scrotum.
All right, I'm sure we'll soon go on the break. We have quite a number of questions that have come in, so let's quickly take a look at some of those questions. Victor, I'm sure you have some. I'll just read some that I have here. This one says, if a man above 40 has one testicle that has shrunk in size, what could be the cause and solutions, please? Another one says, good morning and thank you for this interesting topic. Please, I want to know the possibility of having children with just one testis.
Okay.
Another one says, a lot of young men engaging themselves with sexual enhancement drugs to satisfy a woman. Can such lead to male infertility? This one says, male infertility topic. Please ask the doctors, is it possible for a man with infertility problem, no sperm in the semen, to become fertile again when he marries another wife or from outsourced, meaning side chicks? I heard that various women have the ability to boost fertility. Can a woman boost the fertility of a man? That's the question there. Another one says, good morning, sir, and well done. This is a very interesting topic. Please, my question is, what causes quick ejaculation? Does quick ejaculation mean you can't produce a child?
Okay, let me start with the testis. I think there are about 5 questions, right?
Yeah.
Now, all the vital organs in the body, they are paired. The eyes, kidney, breast, testis, ovary. But in real time, you don't really need 2 testes to raise a family. So we want testes, as long as that testis is producing adequate sperm, good quality, that man can actually raise a community, not just a child. So we can raise a community. Yes, and the reverse is also the case. You can have 2 testes that are not viable. You can have 2 testes that are not descended, or descending very late, and if they are affected, you can have 2 testes that have maybe been exposed to radiation, damaged by radiation chemotherapy, and yet that's not producing viable cells. So if you have 1 testis, and that testis is viable. I had a patient at a time in a national hospital, about 55, who has even completed his own family. Yes, I just one testis. Yes, we have to go and search that second one, because if you have a hidden or undescended testis, that can lead to that that's cancer of that particular one. So with one testis, you can raise a family. So that shouldn't be a problem. But that one testis must be able to produce adequate quality sperm.
What about shrunken testicle?
Now, shrunken testicle, meaning that the testicular volume is reduced. I assume that's what that person means. Yes. Now, when testicular volume is reduced, that does not mean that testis is not producing sperm. It's producing, but it may not be enough. So it depends on the quality, on the content and the quality that it's producing. Now, the normal sperm count can be as high as 200 million, but you don't need all that to fertilize egg. All you need is one. But along the pathway, when the semen is released, the nature has a way of selecting the most viable among them. So it's the most viable that actually fertilizes the egg in the female tract, as the oviduct. So if the person is not producing, if he has a reduced testicular volume, produce it, as long as that quantity is okay, you can still go ahead and fertilize and impregnate the woman.
Can a woman improve the fertility of a man?
That is not likely. So
if you change the woman,
no, what
determines your status.
What determines the man's fertility is the sperm that comes from the testis. But mind you, woman A may be fertile or more fertile than woman B, or vice versa. So that's why it's possible that
meet somebody halfway.
Yeah, the man may take a long time before the first wife get pregnant, and a shorter time before the second wife get pregnant. But it's not that the second wife is now the one boosting the fertility of the man. No. So that inherent ability is in the man himself.
They simply meet halfway. All right, I have questions.
What about quick ejaculation? Sorry,
no,
quick ejaculation.
Is different. That premature ejaculation is completely different. You can still have premature ejaculation and yet be able to. Once the sperm is delivered into the female tract, and there's enough sperm cell, viable, good motility, good morphology, it can. In fact, the problem of premature ejaculation has to do with that borders on sexual satisfaction, which has to do with the problem of erection and things like that. But you can have premature ejaculation, and yet you can still be able to impregnate a woman.
All right. I have questions of my own, but I think we go on a break at this point so that when we return, we can begin with the questions that I have. Please stay with us. Good Morning Nigeria continues after this time out. All right. Thank you very much for staying with us. If you've just joined us, this is still Good Morning Nigeria on the network service of the NTA. And we've been discussing infertility in men, and it's been so far an enlightening conversation. So much has been said already, but we have questions that came in, which we should take now. This one reads, good morning. Are there any drugs that one can take to bring back an erection in man? Another reads, good morning. Doctor, please, is there any medication for treating varicocele apart from surgery? And this one says, my name is Frank. Can depression trigger andropause? And then another good morning. My question is, what's the remedy for quick ejaculation? This is causing problems in my marriage. The next one is, this is a very important and serious topic that should be aired from time to time on NTA because it will help so many homes. Now, many men have been always putting the blame on their wives. But with today's awareness by all the doctors in the studio, I believe many homes will be free of blame games. That's from Fidelis Luxinanje in Abuja. And good morning, our urologists and anchors. My question is, how can one know if a young boy of 13 years has problems in relation to andropause? Andropause? If he doesn't share it with his mom. Okay, thank you. And finally, good morning, doctors. I was diagnosed with diabetes at age 4. I'm 27 years old now. Could it be possible that diabetes has affected my fertility? Okay, let me start with
the question on the drugs for erection. Yeah, there are drugs that can be used to treat erection. Okay. But what we always advise is that it's not just to rush to the counter or to go and buy drugs. Before you start taking any of those drugs, it's better you see your doctor, see a urologist, who will evaluate you and find out what is causing this erection. You see, erection, just like we have causes for infertility, we also have causes for erection. Is it a medical cause? Is it psychogenic or organic? If the erection is caused by a particular medical problem, like diabetes, which I will mention later, it's better you treat that one first. Because if you have not treated the primary problem of the erectile dysfunction, and you are using drug, it's just like taking paracetamol when you have malaria. So what we advise, if you have problem with erections, go and see your urologist. But there are a lot of drugs, there are quite a number of them now. And they're very, very, very effective.
All right, Dr. Nabasu, let's look at, somebody was talking about if there's any medication for treating varicocele apart from surgery. Another talked about depression triggering andropause, if it's possible.
Medication to treat varicocele, not now. We don't have that now. But there's an option if the one doesn't want to go through surgery. It's still a procedure, what we call interventional radiology, embolization. But that is not the first line treatment for the varicocele. The best and the first line is still the surgery that gives a better outcome. So embolization has to do with a process of passing a catheter through the person's vessels. That is done by interventional radiologist, not urologist now. So they pass a catheter and inject something into the system, into the veins to go and block the veins that are problematic. So, but like I said, that is not the first line. Then
can depression trigger andropause?
Andropause, no. Depression to trigger andropause on its own, no. No, andropause, like you say, the term andropause is rather a misnomer. It's Adam, which has to do with gradual reduction in testosterone. It has to do with age. As a person ages from the age of 65, you notice a reduction. From the age of 50, there is a gradual reduction in testosterone, 1% per year. And then not really depression. So it's time that
and another thought about quick ejaculation, if there's a solution that is causing marriage with his or
premature ejaculation.
Premature ejaculation, whether it's...
Yes, that is causing problems in my marriage. I don't know whether
yes, such a person requires an encounter with a urologist. He requires counseling, probably not one session. Because premature ejaculation is more of an anxiety problem.
It will be excitement.
The person is anxious before you know he has already ejaculated.
All right. Well, we need to begin to round up the conversation. Dr. Lawal, let's hear solutions. You tried mentioning a few earlier. But speak about diet. Are there things that you could eat that could boost your sperm quality?
Well, we encourage a lot of natural food these days rather than some of these food that have been processed. We encourage a lot of that because that tends to help in boosting the activity. We also encourage that some lifestyle modification too have been known to be very helpful because one of the conditions that can also lead to fertility when the person is obese. So any condition that can cause obesity can also lead to fertility. So weight reduction, regular exercise, avoiding cigarette smoking, avoiding alcohol have been known to be very helpful.
Exercise?
Exercise, yes, exercise. Exercise is very good. Yes, and weight control is also very good. It tends to help. Yes.
Does prayers have any solution? I mean, can you consult your pastor? Can you pray about this?
Well, you can always pray about anything. Doctors are also God-fearing. So anything you believe in, yes, but we always advise that you seek the advice of the expert first, where you pray, yes, not the reverse. Now, for example, now a patient with varicocele, like I said, if you speak early, it can be treated. But I once had a patient of, I think he was 35 years, bilateral varicocele, grade 3, that's the worst. If he was sick when he was much younger, the surgery will have reversed all those parameters. By the time the patient was presenting, the testicular volume was so much reduced. And even if we do surgery at that time, the outcome would not be as good as it has been when they have come much earlier. So it's good to pray. You understand? We are God-fearing. I pray 5 times a day, but always seek the advice of the expert.
Is it possible to have post-infertility? What do I mean? So you already have a child, but you've impregnated a woman once, but you can no longer impregnate a woman.
Yes, it's possible.
What could lead to post-infertility?
Okay, it can occur in both men and women. Do you understand? Now, if after the first child, for example, the patient has torsion. Torsion can be unilateral. That's one affecting one testis or both testes. If you affect both testes and the patient is breastfeeding late, you have to remove the testes. That patient is going to have a problem. If somebody has a blockage of the tube, ejaculative duct, it can affect it. So it can happen after that. But in such a case, what we want to do, we try as much as possible to see if there is any kind of intervention you can do. If somebody has, maybe the person developed cancer after the first child and is exposed to maybe radiotherapy, you understand? It can affect the testes, and that person can develop impaired sperm production, or the patient is exposed to chemotherapy. So that's why when you have conditions like that, you always tell the patient that the risk is high. We need to take your sperm for banking. So after your treatment, then you can now use that for assisted reproduction.
Is TRT a safe option in Nigeria, testosterone replacement therapy? Is it a safe option in Nigeria? What are the risks and benefits?
Okay, testosterone replacement therapy is one of the options that can be used in patients with ADAM, that's the deficiency of the aging male. But before you start it, you need to see your urologist. Because once you give that hormone, it also has its own risk. For example, one of the commonest cancer you see in men about middle life, 50, 60, is prostate cancer. And it's established that patients that are exposed to testosterone supplement have greater risk of developing prostate cancer, even breast cancer in men. So if a patient is going to be on TRT, that patient needs to. And if you have to give it at all, you have to be low dose, and it should be for a short time. It's not something you go off the counter until you want to purchase.
Now that you're talking prostate, okay, now that I'm talking prostate, okay, please go ahead. Go ahead, Ad.
Apart from what you just mentioned, the TRT, if it's with the aim of improving fertility, is contraindicated. So you are replacing testosterone. The aim should be different, like you mentioned, Adam, not with the aim of improving fertility. Once there is fertility concern, so that is contraindicated. Just to add to what you said.
Now, I've heard people say that men that are less sexually active are more prone to developing prostate cancer. How true is this? That the more active you are, the less inclined you would be to prostate.
Yes, we've heard that recurrently. It has been a recurring question in clinics, at fora like this and everywhere. It's if you recall, there was a disclaimer that was posted by NAWUS, our association in Nigeria, just to educate Nigerians on this, because it has. My friends ask me the same questions. Is it possible? People have tried to do a research on that, but there was no correlation. There was no strong correlation that was found between these two. That being sexually active reduces the risk of
even if not
cancer.
Sexually active, but just ejaculating regularly.
Ejaculating, no. It's, you can put it either way, being sexually active or ejaculating, because some people will tell you if you ejaculate 21 times in a month, that the risk of developing prostate cancer is reduced. That was debunked by the association. So the answer is no. So people should not take that as a strong correlation. Yes.
Okay. I'm thinking about emotional, your affection towards your wife. Does it affect your fertility? So if maybe some people are forced to get married, some will tell you, well, because you're not happy about your partner, so you become. I mean, does it affect your fertility in any way?
It can affect your sexual interaction. So that's why when we define fertility, there are some keywords that are there. There must be evidence of regular, unprotected sexual intercourse over a period. So if there is a problem of affection, most likely the couple will not be having adequate sex. So if they are not having adequate sex, They are not staying together. Or if it's love across the ocean, one is in Lagos, one is in Kano, or one is in Nigeria, one is in US, you cannot say they are infertile. So there must be regular, unprotected sexual intercourse for a period of at least 1 year. So the affection will affect sexual interaction, but not directly the fertility.
Fertility.
Now, as we gradually round off this conversation, what role can awareness play in, reducing the cultural silence around male infertility and andropause?
Awareness has a strong role to play. In fact, this kind of role is one of such. One is that male infertility is common. If we don't take anything from method, you can take that. To the bank. It's as common as female infertility.
Please say it loud so the women can
hear.
Male
infertility is common. And it's as common as female infertility. So you can take that to the bank.
But who should lead the campaign? Because it's a question of awareness now. Is it your association? Is it individual doctors? Journalists, media is unlikely to speak about it on their own because they're not specialists.
It's everybody's duty. On our part, we are trying our best as an association. We have a body of urologists in Nigeria, and from time to time, almost every year, we meet every year. But even at zonal level, we meet. Even at state level, we meet. And some of these things, we bring it up. Also, our sister colleagues, the gynecologists, they also do that. So we must gather awareness. The media has a significant role to play. That is number one. Number two, the fact that the couple has infertility is not a death sentence. Now, there are so many facility centers available. You don't have to say, okay, you go to the medical house, I deliver at 60 years. No. The fact that you have your babies by IVF is not a crime. It's not a big deal. But outside the country, when a couple, they are married for a year or two, and they don't have children, the couple go together for the first time. So they are evaluated together. So you are able to pick where the problem is, the man or the woman. In fact, it is cheaper to pick it in the man, because in the man, just doing a sperm analysis, and maybe FSH, you can know where the problem is. But for the woman, you have to do so many tests to pick the particular problem. So awareness is very, very, very important. Number three, right now, there are so many centers that have facilities for IVF. I just told you that the National Hospital is available. I'm aware of some other centers too. And not just that, National Hospital and NTA Premier, they are certified to train IVF experts. So I'm beginning to see in the next 5 to 10 years, we're going to have this facility available in so many government hospitals. So that will drive down the cost. So people can just walk into a government hospital if they need it. So the awareness actually play.
But have you found couples who just don't want to have children the natural way? They just decide to go through assisted reproduction. Have you found in your practice couples like that?
I can't remember meeting a couple like that. I don't want to have
just
children the natural way.
Some other way.
I don't think I can remember meeting a couple like that. Maybe
so what are your final words to men as we round off?
Well, my final word would be that because infertility in men is as common as it is in women, we encourage couples to always check themselves for fertility, even before marriage. They check themselves, both, not just the woman. We encourage them to check themselves for fertility before we go ahead.
Well said. Very interesting topic. I hope mother-in-laws, wives, and
and father-in-laws,
have also heard all of this, so that we can be able to handle issues in our families. Many thanks, doctors, for joining us. Dr. Nabasu Lemesh Ezra, consultant urologist and HOD surgery, NTA Premier Hospital, Abuja. It was indeed a pleasure to have you. Thank you so much for sharing your insights with us.
Thank you.
And
Thank you for having me.
Dr. Ishaka Lawal, Chief Consultant, Urologist at the National Hospital, Abuja. Thank you so much, sir, for sharing your knowledge with us. And we hope that a lot of men will begin to come up and own their problems so that we can. Victor.
Well, I see you thoroughly enjoyed this conversation, and I congratulate you on your experience.
Beautiful experience. I'm knowledgeable now. So, the men, you need to keep your shoulders down, and women, please, seek for a solution too. So that's our program today. Very educative and very interesting. I'm sure you've learned something new. I'm Ian Ray John, Level Locked on the NTA.
And I am Victor Azu. We wish you a great weekend. Thank you for joining us, and see you again on Monday.